Medication Therapy Management, or MTM as we call it, is a program where you get to meet with a clinical pharmacist and discuss your medications. When you meet with your pharmacist, they'll sit down with you and go over all your medications, including your prescriptions, any over-the-counter medications, supplements, herbals that you take. They'll review those medications to make sure that they're safe, that they're effective, that you're not having side effects, and they'll look to see if there's any ways that they can help to save you money. We work with your doctor to make sure that your medications are safe and effective. Many times doctors will refer patients to us because we help to find solutions to common problems that patients have, including side effects, cost of medications, and not wanting to take their medications. The more medications that you take, the greater chance that there is that you could have an interaction with your medication or a side effect. We screen all those medications to make sure that they're going to be safe for you, effective, and that you're going to get the most benefit from your medications. You'll meet one-on-one with your pharmacist in a private area where they can discuss your medications. A typical first visit lasts 60 minutes because there's a lot of information to go over. We ask that you bring all of your medications, including any prescription, over-the-counter, any supplements you take. If you're unable to bring in your products, we ask that you bring in a detailed list of those medicines. Some patients will also bring in any recent lab work that they've had done, so the pharmacist can review that as well to make sure that the medicines are working. The pharmacist will then go over each medication and determine when you're taking it, why you're taking it, and screen for any side effects from the medications. At the end, the pharmacist will then formulate a plan that will be sent to your doctor and will also give you patient information to review with your doctor at your next visit. I had a patient who had multiple doctors. She saw her primary care doctor and she had 2 or 3 specialists, and all of these doctors were prescribing the medications, and she went to a few different pharmacies to pick these up. What we found is that 2 different doctors had prescribed a very similar medication, and by her taking these 2 medications together, she was having side effects. Once we found out that she was on these 2 medications, we were able to consult with her doctors to determine which medication they wanted her to take. Once she stopped using the 2 products together, she started to feel better. We receive lots of positive feedback from the doctors, finding medications that really help their patients when things have been challenging for them in the past. We really get to sit down with patients and thoroughly analyze their medicines and provide that information back to their doctors so that their doctors can make great decisions for the patients. I've had patients where after analyzing their medications, we found some potential recommendations. I had a patient who over the course of the year was able to save $750 in copays. This program would benefit patients who take a lot of medications, who take medicines multiple times a day, patients who are concerned about side effects of their medications, patients who are concerned about the cost of their medications, patients who are worried about the long-term effects of taking their medications. I recently had a patient who lost her job, and she had high blood pressure and diabetes and high cholesterol. And she had to stop taking her medications because she couldn't afford them. So we worked with her doctor to find some medications that were less expensive, that still worked to control her blood sugars and her blood pressure. And she came back in a month later feeling great, taking her medications every day. And she felt really lucky that we were able to find some good choices for her, that she was still able to take her medications. If you're a good candidate for the program, HealthPartners will send you an invitation letter with information on how to enroll. If you're not a member or you didn't receive a letter, look on our website for more information about our program.